Hi, my name is Yale.
And my name is Jane. And today we're going to demonstrate insertion of an intravenous catheter.
And I hope you enjoy it. First step would be check the doctor's order for intravenous therapy.
Yes, there's an order for intravenous therapy.
Step 2, gather all the articles needed. Blue pad, non-sterile gloves, goggles, IV start kit, saline flush, venous access device, and saline lock. Step 3 would be wash your hands. Step 4 would be greet your patient, introduce yourself, identify patient using 2 identifiers, provide privacy, and procedure explanation.
Hello, my name is Jane. I'm your registered nurse today. Can you please tell me your name and your birth date? When you tell me that, I'll be checking it against your armband.
My name is Christina Lopez. My birthday is June 1, 1987.
Okay, and do you have any allergies?
Not that I know of.
Okay, your physician has ordered intravenous therapy. That's like I'll be putting a little needle into your vein so we can give you some fluids. Are you right-handed or left-handed?
I'm left-handed.
You're left-handed? Okay, in that case, we'll try to start your IV on your right side.
Okay. Step 5, adjust the height of the bed or chair for patient's comfort and body mechanics. Step 6, identify or scan for appropriate venipuncture site.
Hi, Cynthia. I'm just going to continue to look for a good IV site. So, are you a dialysis patient?
No.
And you haven't had a mastectomy?
No.
Okay, and I haven't had a stroke?
No.
So I'm just kind of looking around. I don't see you've ever had any other IVs here recently, and I don't see you've had any surgery or anything, so I think this is going to be a good arm to start your IV on.
Okay. Step 7, apply the gloves. Step 8, apply tourniquet to engorge veins and further facilitate selection of appropriate site. Step 9, release tourniquet. Never leave tourniquet on for longer than 1 minute to decrease the risk of vein damage. Step 10, prepare a saline lock by flushing it and leaving syringe attached to the tubing.
So we're taking the saline lock out of the packaging. And remember, sometimes there's a little bit of air in there, so we want to take the air out. And now we're opening the saline lock. If you're careful, you won't need to wipe off the O's. We'll be opening up our saline lock. And if you pick it up carefully, the end of this place where we'll be irrigating will still be sterile, and you can use your saline lock and then just push the fluid through till a little bit saline comes out the end. And now the end of the lock, if we loosen that a little bit so that it'll come off easily when we're ready to use it. And you can just leave it inside leave the end inside the little container here, the little boat.
Step 11, apply tourniquet for the second time around. Facilitates observation and puncture of vein. Step 12, cleanse site using friction. Follow facility policy regarding cleaning agent.
So we have alcohol and chlorhexidine here. So use whichever one your facility recommends you using. If you use alcohol, you need to choose your IV insertion site, and you start right at the site, and then you gradually move in a circle away from it. You're prepping a site maybe 2 to 3 inches wide. You're using friction, and you're cleansing for 30 seconds. If you use chlorhexidine, try avoiding touching the tip that will be touching the insertion site. You have to crack like a little ampule inside of there so that it will moisten the tip. And with this one, you can just go back and forth. Both of them require 30 seconds to work. You're prepping a site like 2 to 3 inches, and you're going to let it air dry. No blotting, let it air dry. Okay, while you're waiting for your IV site to dry, we'll prepare our cannula, avoiding moving over the site that you just prepared. We'll get our cannula here, opening our package. What we're doing is we're removing the cover, and we're going to actually rotate the cannula over the needle 360 degrees, and then you seat it back down there. And the purpose of that is so that the cannula will come off. We're making sure that the cannula will come off of the needle easily.
Step 13. Stretch the skin taut and stabilize vein with non-dominant hand. Step 14. Insert catheter. Small superficial veins are best accessed at 10 to 25 degree angle. Deeper veins should be accessed 30 to 45 degree angle. Once the skin is pierced, reduce the angle of the venous access device to almost flush with the skin. Upon entrance to the vein, the nurse may feel a popping sensation and will see a flashback of blood in the chamber.
Okay, Cynthia, now I'm going to be putting the needle in your vein. So just put your fingers around my fingers, and I'll just be pulling your skin tight here so that the vein doesn't roll. And so you're just going to feel a little bit of pain here. Okay, so we're entering the vein, and then we're dropping the angle, and we'll insert another 1/4 of an inch. And we see some blood coming back in the chamber here. So now you can take your non-dominant hand, and you need to slide the catheter off of the needle till you can't see the catheter any longer, and use your fingers. You still need to hold this catheter, and you need to use some other fingers of your left hand to make sure you put some pressure right here above the vein, or you put pressure on the vein so that the blood doesn't leak back. And then you can shield your needle. Oh, and you got to push hard or some blood will come back. And don't forget we loosened our little cap here.
Step 15. Attach sterile end of prime tubing to the catheter hub. Helps prevent backflow, connects fluid source to venous access, and maintains sterility of the system.
So now we're checking oh no, we have to take our tourniquet off. Right, you guys?
Aspirate and flush to check for blood return confirmation that is in the vein. Flush the catheter so the clot does not form.
Okay, so we're aspirating and we see the blood return. And now we're flushing the catheter so that it stays patent.
Step 18. Secure the catheter.
So if your facility uses any kind of securement device, you could use that. We don't have that today, so we'll make sure that this little connection is tight, and then we'll use our Tegaderm.
Use a manufactured securement device whenever possible. Use a transparent dressing to cover the venipuncture site and catheter hub. The tubing should be curled to the side and held in place with a piece of tape or J-loop.
So we're putting our tegaderm on here. And by J-loop, we mean forming a little loop like this so that if there's tension on the tubing, it will not remove your cannula. So now we're disconnecting the saline flush, and we're creating that J-loop that we've talked about. So we have our tape. Alrighty. There we go.
Clean up the bedside, remove gloves, and wash hands. Date, time, and initial the IV site, and document it in medical record. The site, the size of the catheter, number of attempts, and where attempted.